Hi, everyone, and welcome to our Mid-Atlantic Permanente Medical Group Facebook Live event on exercise and injury production. My name is Dr. Jennifer Gourdin, and I'm a family and sports medicine doctor at our Kaiser Silver Spring location. Recently at Silver Spring, we just started a new sports medicine program where we're treating athletes ages 12 to 65 with sports-related injuries. So if you want to talk injury prevention, if you want to talk pre-participation physicals, or if you have an ankle pain, knee pain, shoulder pain, muscle strain, or maybe even a concussion, we want to see you there. When you come to see us at our sports medicine program at Silver Spring, you'll see both a sports medicine doctor and a physical therapist, and we both will contribute to your evaluation and treatment plan. Today, I'm joined by my wonderful sports medicine colleagues, Dr. Sisson and Dr. Amoako. Dr. Sisson, would you like to tell us more about yourself?
Hi, thanks, Jennifer. I appreciate being able to have the chance to be involved with this. My name is Rich Sisson. I am a board certified family medicine doctor and also certified in sports medicine. I've worked here in the DC area for about 4 years. Prior to that, I lived and worked out in Colorado, treating sports injuries and athletes of all ages. Currently, I work in the Northern Virginia region at several clinics there in the orthopedic department as a non-operative sports medicine doctor, and I'm happy to be here. I encourage anyone who's watching, if you have questions, send in questions through the Facebook feed, and we'd be happy to answer anything that comes up.
All right, as Dr. Gourdin said, my name is Adae Amoako. I'm a family medicine physician and also a sports medicine trained physician. I currently work at the Kaiser Permanente Advanced Urgent Care in Gettysburg. I'm excited to be here today, and I hope we have fun while we are learning about sports injuries. Bring all your questions and let's do it.
Yes, all right. Yes, so definitely thanks again, everyone, for joining, and please enter any questions that you might have into the chat. I think we'll start our conversation off with the first questions, just talking about some of the benefits of exercise. You know, exercise isn't just about weight loss. There's lots of other health benefits. It's good for our overall health. It helps to improve our brain function, our heart function. It also reduces our risk of developing chronic conditions like diabetes, heart attacks, strokes, depression. And, you know, it just helps us to live longer. Dr. Sisson, do you want to talk a little bit more about maybe some of the mental health benefits of exercise?
Sure. You covered it. There's certainly a lot with physical health benefits, and there are, and people think about that a lot. There's also a component where we know from research and studies that regular exercise can also help with anxiety and depression. There may be the thought that actually just getting out and getting your body moving helps you function better, not just physically, but mentally as well. I don't know if anyone knows exactly what all the reasons are, why it helps, but there's some thoughts that perhaps exercise helps increase endorphins and positive chemicals in the brain that help you feel better. I think there's definitely the thought that getting out and changing up your routine helps just kind of mentally take a break from things. And exercise and regular activity can help kind of get you healthier overall, not just physically, but also socially and emotionally with contact with other people, groups that you work out with, and the component of somewhat of a community too. So it's not just about your body, it's also about general well-being.
Yeah, totally agree with you there, Dr. Sisson. Dr. Amoako, when you're talking to your patients, what are the different categories of exercise that you discuss with them? And how much exercise do you normally counsel patients and tell them that they need?
We often get, thank you very much, Dr. Gourdin. We get this all the time because as physicians, our patients look up to us for guidance, especially when it comes to their physical well-being. And exercise is one of those things that we do in addition to other things like nutrition. So when a patient comes to me and asks me, especially if they have been out of exercising for a while or they are just getting started, that's when they really need the guidance. And when they come, they're going to ask me, how do I start, doc? Well, there are different types of exercises, but I will put it in two different categories. Mainly, when we talk about exercise, we're talking about the intensity of the exercise and then the type of exercise. And so give you examples so that those that are listening can take from it. Intensity of an exercise means how hard the exercise is, how high. So there is the low intensity exercise, moderate intensity, and then high intensity. And low intensity exercise could be something like walking at a casual pace, slowly lifting weights, cycling at a casual pace, sometimes even just light jogging. A moderate intensity exercise could be something like brisk walking, at least 2.5 miles per hour. Water aerobics can be considered a moderate intensity. Dancing, a lot of patients like they like to do something that they enjoy. So dancing could be an example of a moderate intensity exercise. And then there is the high intensity. High intensity, people are what actually people know because of how it has been commercialized. High intensity interval training, like, or HIIT as we call it in medicine, like insanity. Insanity, for those of you that follow some of these workout TVs, insanity is considered high intensity. Running, just running at a very faster pace, jump roping, speed walking are all considered high intensity exercises. Then, so when it comes to high intensity, what I will usually tell, intensity in general, what I will usually tell patients are that start at your own pace, listen to your body, and you can use the talk test. The talk test. The talk test is conversation level testing, and it's a simple way to measure the intensity of an exercise. In general, if you are doing a moderate intensity activity, you can talk, but you cannot sing. If you are doing a very high intensity activity, you will not be able to say more than a few words without pausing for a breath. So that's your high intensity and the talk test that you can use. And then we talk about the type of exercise, Now, any cardio activity that will increase your heart rate. So cardio is one of them. Then there's strength training. We're going to talk a little bit more about this later. And then there's endurance or flexibility. As we go with our conversation, I will give you more examples of these. And then when we talk about how much exercise one should do, that depends on a lot of factors, and we're going to touch on some of this later. I'll bring it back so that my colleagues can have a chance to talk. But usually, the American Heart Association will recommend at least getting 150 minutes of moderate exercise a week. There are specifics to this, and I'll touch on that later. Now, if you haven't exercised for a while, someone would say that 150 minutes is a lot. How would we get started? I'll let my colleague, Dr. Sisson, take that.
Thanks, Dr. Amoako. Yeah, it is. There's that number that's 150 minutes a week, which is recommended exercise, which shows up more now. So if you notice, if you come into one of our offices or clinics, see your regular doctor or your OBGYN, the person that's rooming you will ask you, do you smoke? How many drinks of alcohol do you have a week? And how many minutes do you exercise in a week? And so it really is this thing that there's at least a recommendation about how much you should do, and it is recommended 150 minutes a week. And the reason that we're trying to be mindful about it is because we know it helps with health overall. If you haven't done anything for years, 150 minutes a week might seem intimidating. So in truth, something's better than nothing. So if you start from a place where you're really not exercising and haven't done it, just getting started and doing something that will get you moving is good, no matter what it is, because any time is better than zero. I usually tell people that if you haven't exercised for a while and you want to get started up again, it might help to initially know what your motivation is. So why do you want to do it? Are you trying to be more fit or more active? Are you trying to live longer for your kids? Are you trying to lose weight and feel better? Some of the other things we've talked about, because keeping that in mind might help you kind of stay on track about what your goals are. The other things that I often tell people is try something that you think you can stick with, or something that you actually enjoy, rather than just forcing yourself to do something you don't like. So if there's some activity that you like doing, it doesn't have to be like Dr. Amoako mentioned, some intense boot camp or exercise or something that's intimidating. You can walk, you could jog, you can get out and walk your dog a couple times. I often tell people too that one thing that helps make a regular routine stick more is if you hold yourself accountable in some way, and that might be finding an exercise buddy or a partner to say we're going to meet up 2 or 3 times a week, just so that you know somebody's waiting there for you, so it's not so easy to skip out on doing it. Or joining up with a local club like a hiking club or a tennis club, or some local meetup activity or group, or going down to the park and playing pickup basketball or soccer or something else. Just finding something you like to do, I think, is part of making it actually more successful and fun.
Awesome. I think those were all great pieces of advice and lots of great information that both of you all shared. Okay, so our next question is, I'm nervous I'll get hurt when I exercise because it's been too long. What can I do to prevent injury? I think I'll take this one, guys, if you guys don't mind. So when I'm counseling my patients on injury prevention, I like to use this acronym called SEEDS, SEEDS. And the S stands for sleep, E stands for eating healthy, the other E stands for equipment, the D stands for drinking water, and the last S stands for strength and stretching. And so with sleep, going back to the top, with sleep, you should be getting at least 7 to 8 hours of sleep per night. That's really important to practice good sleep hygiene, going to bed in a quiet, dark room, setting a bedtime for yourself, making sure that TVs and phones are turned off, really gives you a good environment for getting good quality sleep. When it comes to eating healthy, you want to eat a diet rich in fruits, fresh fruits and vegetables. And also some whole grains as well. In terms of your equipment, you want to make sure that you have the proper footwear and helmets and whatever else is needed for your sport. And, if you're a runner, it's really important that you have, the proper running shoes and that you change them every 250 to 500 miles, because if you don't, that could affect your stride, and it could lead to different types of injuries and overuse injuries. When it comes to drinking water, we should be drinking, all of us should be drinking at least 64 ounces of water a day. But, when we're doing more high intensity workouts in different sports, we probably need more than that. But at least, at a minimum, I'd say at least 64 ounces of water a day. With strength and stretching, stretching improves our flexibility and, strengthening our core and our hips and our legs. That's all important things that we should do in order to prevent ourselves from getting hurt. I think, overall, like I think Dr. Sisson was mentioning, it's important to kind of have a gradual progression in terms of getting into your workouts and getting into whatever conditioning that you're going to be doing for your sport. You never want to go too fast, too far too fast, because that's kind of breeding grounds for you to possibly get injured. I think the only other tidbit I would add in there, a piece of advice I would say is, technique. Pay attention to your technique. If you have a coach or an athletic trainer, have them evaluate the techniques that you're using for your sports to make sure that you have proper form, because if your form is off, that can be grounds for you having an injury in the future as well. I don't know, do you guys have any other
just to
pieces of advice?
touch on something, Jennifer, you Dr. Gourdin mentioned sleep. So I probably do not sleep enough. I don't think most people, if you took a poll, a lot of people don't sleep enough. But like sleep and equipment and preparation, it also brings up this idea. There's other tools that you can use too. So I have on like a watch. There's activity trackers that you can wear. I find for myself having something like that, it just gives you some feedback about how much do you move during the day, how many steps do you take, or how much do you sleep at night. And I think knowing for myself, like I'm aware that I could or probably should sleep more, but young kids and everything else, I don't. But at least I think some of those things are good tools for feedback too, to see like, how are you doing overall, and take some accountability about how you're treating your body. And if you say, well, I feel pretty run down this morning, so, well, I went to bed pretty late last night, or I don't feel so good today. So, well, I just sat in a chair all day, or said I didn't do anything. So I don't know about you guys, but do you have any thoughts about like external motivating things like that, fitness trackers, or like exercise classes or groups? Is there anything that you guys yourself do, or you think is helpful to kind of keep you motivated or kind of give you feedback about what's going on with your body?
Well, I'm a working mom. I have 3 children. And so fitting exercise into my routine, it's a struggle, And I think one thing that I found helpful is using like an exercise app on my phone that has just, 10 to 20-minute workouts that I could do like really quickly, I can fit it in maybe at the end of the day or at the very beginning of my day, and just being able to have quick access to that on my phone. And maybe I sometimes I stream it onto my TV at home, and I just do my quick workout. I think that works best for me because I often don't feel like I have time, to make it to the gym or to, go out and do a group activity. I also find it helpful to, like you mentioned before, have an accountability partner. With your Apple Watch or your Fitbit, you can compete with other people. At least with my Apple Watch, I can. So I have my best friend on here, and we compete, and we, see who can get the most steps and who can burn the most calories. And I think that helps to kind of keep you motivated and hold yourself accountable and make sure that you're getting enough exercise in your day-to-day routine.
I totally agree. Having a partner, whether it's virtual or in person, definitely helps. And personally, I have found out that if you have a partner that you go with to the gym, or you communicate regarding what you are doing or what your goals are, it definitely helps. Because there could be a day that you don't feel like going, but once your partner calls you up that, hey, buddy, let's go, you will be motivated to go. So I think getting a partner for accountability, but also just motivation in general, is a good way. And I love these external apps. I'm a technology person, but sometimes you get drawn into it that you just keep digging yourself. You get this app that does that. You get this app that does that. Please, my recommendation will be stick with one that has the most features that you like. But they do really help and motivate.
Dr.
Well,
Gourdin, you mentioned that you have an app on your phone. What can I ask? What do you use, and how'd you choose it?
yeah, I use Fit On, and I chose it because I was searching for a workout app that had short, you know, workouts, and that was what came up on my search, and it had good reviews. So I said, oh, let me try it out. You can also you can invite friends to join the app with you, and so you can compete with them through the app too. I don't do that since I have my Apple Watch, but that's also an option. And like I said, I found it works for me, and it works for my schedule, because if I only have 10 minutes, I can quickly have access to a quick 10-minute workout. Or if I have more time, there's 20-30-minute workouts that I can click on. And I think there's lots of workout apps out there for you to choose from, and most of them are free, or at least have some videos within them that are free. And so I think I definitely would encourage patients to look into that, especially if you're like a working mom like myself.
Yeah. If people are watching that are Kaiser Permanente members, so people that we take care of in the region, I found out recently that there's benefits just as part of the insurance or being a member with Kaiser, that you have access to free exercise classes through an app called ClassPass. And then there's also discounts that you can get on exercise equipment, including like Fitbits or activity trackers. So I think we have a link for a page that can send people for more information if you're a Kaiser member and you want to do that. So that's one option. But certainly, like you said, there's lots of free options too. There's tons of workout videos on YouTube. There's lots of free apps. So I think, like Adae said, pick one that you think you'll actually use and just find something that you'll stick with.
Yeah. Okay, guys. Well, our next question is, what medicines or treatments are available if I have pain with activity? Do you want to take that one, Dr. Sisson?
Sure. This is one that comes up when I see patients in clinic. I think that everybody kind of has their own things that they use, or their own tricks or techniques or medicines. Some people I see and they say, I don't want to take anything. And some people are very specific about what they will or won't take. I would say just in general, for any patient aged like 12 to 80, there's two big types of medicines that you will find if you go to the pharmacy and you have like pain. You go down the pain relief aisle. One type is just Tylenol, or acetaminophen is the generic name. But Tylenol is its own thing. You can take Tylenol pretty safely for the most part, unless you have some underlying medical or liver conditions. Most people can take it pretty safely. It doesn't affect usually other medicines. It's safe if you're on blood thinners. And it's a pretty safe thing for most people to take. You can read on the back of the bottle what recommended doses are. But for most people who are adults, you can take roughly 3,000 milligrams a day safely every day for a longer term duration. The other type of pain relieving medicines that you'll see if you walk down that aisle are under the category of NSAIDs. So these are non-steroidal anti-inflammatory medicines. And these are the ones you might have heard of, like Advil or Aleve or ibuprofen or Motrin. There's different brand names. These are medicines that you have to be a little bit more careful about taking, especially on a longer term basis, because it can cause some side effects with stomach upset or GI ulcers. They can interfere with other medicines. They can affect your kidney function, or affect if you have high blood pressure, and they can interfere if you're on blood thinners. So I think you have to be careful about which of those two categories you take. And it might be a thing where you ask your doctor about what's the safest or best for you. But I think at least knowing that there's a difference in those two general ones when you walk down a pharmacy aisle, at least knowing the difference is a good place to start with the medicine. Dr. Amoako, is there things, so that's pills that you can take, and there's certainly a whole textbook of prescriptions and other things, but I think those are the general main types of medicines. Are there things that you recommend for like topical things or heat or ice or other things that people can put on their sore joints when they have pain?
Definitely. Especially in sports medicine, we don't only just do medications. We try different ways that we can help our patients. Because like Dr. Sisson said, not everyone can take medication, especially the ones that we prefer in treating some of these conditions. So then there have to be other ways. So for patients that have issues like ulcers that cannot take anti-inflammatories, we have the topical kinds of medications that you can actually apply on the site of pain or the site of injury, and that can help. Over the counter, there is something like Absa cream. We can also prescribe something we call Voltaren gel or diclofenac in a gel form. But then patients oftentimes will ask, can I use a brace, especially for the knees in adults? I usually tell patients that depending on how they feel, if a patient tells me that a brace is helping them or makes them feel comfortable going about their activities or function, I'll tell them to put it on, but definitely not for long, because you wouldn't want to get too used to a brace if you don't need it. And also, there are some specific braces that we recommend for specific things. There are so many of some of these things on the market that promises or to provide extra relief, and we get bombarded with them on TV. Most of them do not have any medical research backing it. So I do not recommend all braces, but I do recommend just your regular brace if a patient feels that it is giving them some stability or is reducing their pain. I would do that. So besides the medications, we can do the topical creams and gels, but we can also do other physical things like a brace that a patient usually would say that it's helping them or is making them feel comfortable. So those are some of the things that we can do. Then, of course, if you have any specific injury, besides the medications, we can always refer you to a physical therapist to help you build your muscles, strengthen your muscles, help you with some flexibility or stretching things. At Kaiser Permanente, we have exercises that we can give you that you can do at home. And if those things are not helping, we do have physical therapists that we can refer you to. So besides the medications, there are so many other things that we can do to help with treatment when you have an pain during activity or when you have an injury.
Yeah, couldn't agree with you more, Dr. Amoako. I mean, I love suggesting diclofenac or Voltaren gel, especially now because it's over the counter. It's not, you don't even need a prescription, but I just feel like, you know, for acute injuries, a lot of times you need some sort of anti-inflammatory. And so being able to use it in topical form like the Voltaren gel, it helps a lot of my patients. When you get patients that are over 65, Dr. Amoako, and they say, you know, can I still exercise? What type of exercise should I be doing? What do you typically how do you typically counsel them on that?
Thank you, Dr. Gourdin. This is a very good question. Our elderly patients, usually, especially when they are getting to the point where almost a lot of elderly patients have arthritis. Not all of them experience symptoms, but arthritis is a change in essentially how things are functioning in the joints. The loss of cartilage is the biggest thing. And once you lose cartilage, there is certainly inflammation, which affects the function and the pain level of the elderly. So when they get to that stage, exercise becomes a problem. But I definitely do encourage exercising for these patients that are over 65. And there are different types that you can do. Earlier, I spoke about the different types of exercise in terms of intensity and also how often. This is where we get in. For my 65 and above patients, I usually recommend the low intensity and moderate intensity type of exercise, but certainly more on the low intensity side. So you should be able to, with low intensity, be able to do the jogging and the walking. That definitely helps. You may not think, for patients, they may not feel it because they are not sweating and do all that, but just walking alone increases your heart rate, and that is good for a 65-year-old. You want your heart to be able to function at a certain level. So low intensity exercise like walking, brisk walking, jogging can do it. And it's not just that. You can do some strength training. You can do some strength training. You don't have to be lifting 45-pound dumbbells. You can just do little hand weights, 5 pounds, just lifting them. You can do some leg weights. You can also do some flexibility exercises like stretching. If you can, yoga. All those things can help even at age 65. So you don't have to do anything crazy. And then when it comes to frequency, Dr. Gourdin had asked before, you don't have to go to the gym 6 to 7 days a week. You can do 3 days of just, it doesn't even have to be consecutive. You can do Monday, Wednesday, Friday. Just moving your body alone is good at age 65. And especially if when you have arthritis, you essentially have to train your brain to get used to what the joint is. So it has to get used to moving. The joints have to get used to moving. For those that are listening, if you are 65 and above, you know, when you sit for a while, sometimes your knee will get stiff. This movement helps a lot, especially with pain and stiffness and inflammation. So low intensity, a few days a week is great when you are 65 years and above. You don't have to do insanity. You don't have to do P90X. You don't have to do any of those big commercial things out there. Just low intensity walking, jogging, swimming, yoga alone is good. It's good.
Yeah, Dr. Amoako, I think, one of the things that came to my mind when you were speaking was just keeping some variety in your workouts. You don't want to do the same thing every time you work out. One day maybe it's strength training, the next day maybe it's cardio, but keeping that variety and also building in some rest days to allow your body to recover, I think is important to note, and will help you in terms of preventing yourself from getting injury or developing an overuse type injury. What are some of the benefits of exercise when you have arthritis, Dr. Sisson?
Oh, sorry.
Oh, go ahead.
I was gonna add on too. I didn't want to jump in, but Dr. Gourdin and Amoako were talking about arthritis, and that it does happen more with older people, and trying to encourage you to keep the joints moving. I agree with all that. The other thing that I think I'd add on is arthritis, like Dr. Amoako had mentioned, is actually just wearing down of the cushion that's in your joints. And that will happen to everybody if you live long enough. And so I often will see people who are 50, 60, and you can't do the same things you used to do before, because it will cause more of your weight-bearing joints, like your knees and hips, to hurt more. And so I think one thing also that people consider is varying the exercise or the type to be lower impact. And so that might be, as you mentioned, swimming, just because there's less pressure on the joints, but you keep the movement. It might be using an exercise bike or a real bike outside, or walking rather than running. So I think a lower impact regular activity is probably something you're going to hold up to better, because your body will tolerate it better. You don't see many people who are 70 years old still on the basketball court or running down the soccer field for a reason. But you do see, the people in your neighborhood are walking every day at 70 or 80 years old, or go to the pool every day, or you see them in the gym, lifting weights or riding the exercise bike. So I think it's important also to change how you use your body and what you ask of it as time goes on. And when your joints wear down, and that's what arthritis is, it's just mechanically wearing your joints down. A lower impact activity is something you're probably going to hold up to better. And so that's why people change their activity profiles over time.
And I just want to add that my general rule for most of my patients above 65 is that start at your own level. You don't have to walk 4 miles. You don't have to walk 3 miles. You can just start by walking a mile. That alone, just knowing that you've been able to complete it, could be a motivation to to move to add more extra mileages to it. And then oftentimes the question I get from some of these patients is that, hey, but I'm 65 and I'm still working. I'm on my feet. Actually, shout out to my mom. My mom told me this one time. When she was still a nurse, that I stand on my feet all the time seeing patients. Why do I need to walk? It's the same thing. But exercise is more intentional. It's different from just a physical activity. It has to be intentional, done at a duration of time with a certain part of the body in mind. So it's not just walking around working. So my 65-year and above patients, I tell them that, listen, you have to have something in mind, that you want to walk a mile, you want to walk 20 minutes for this, how fast. That is exercise, which is different from physical activity that we all do. So, but start at your own level. And that is usually my message to these patients.
I think that's true. You think about people that we see in clinic who say, well, I'm on my feet 10 or 12 hours a day standing at a cashier or register or somewhere else where it's a physically demanding job. But standing there and having sore feet and knees and hips is something that you do because you have a job and someone's paying you to do it. But it's not necessarily good for your body or for your joints. And the goal of having some moderate activity level exercise, and the reason that why that's the recommendation is because it gets your heart rate up. It asks your body to actually kick in these physiological changes to train to make your heart and lungs healthier and work better together, to work on improving some of the health outcomes that we talked about, decreasing your insulin resistance and other things to make you healthier overall. So having a sustained regular activity where your heart rate is up and you're intentionally doing something is different from having to punch in and out and stand for 10 or 12 hours on your feet.
Couldn't agree with you more. I think we'll take another question here. What are some types of exercise equipment that you can use in the gym? And what are maybe some of the most common types of injuries, Dr. Amoako?
Well, I would say that most most adults have similar injuries, just like young people. When you're exercising, some of the most common things that you experience are muscle pulls and muscle strains. Most commonly, we do get sprained ankles, sprained shoulders, some knee injuries. I recently, about 2 days ago, I saw a patient who came in saying that they were walking up the stairs and they had a crack in their knee, and this patient was above 65. As he went on to explain exactly what was going on, my first instinct was that it's probably an exacerbation of an existing arthritis that this patient didn't know, because he talked about the crackles, which patient here all the time, crackles in the knee, the stiffness, waking up very stiff and painful, but once they start walking, it's better. They were kind of surprised to hear that it's just arthritis, but these are some of the things that you will get. It's very commonly the sprains, wrist. You can get wrist sprains, tendonitis or inflammation of the tendons, depending on where you are using to work out or what exercise types of exercises that you are doing. You can also get shin splints. Shin splints are very common in people that run a lot. But these are some of the common injuries, just sprains and strains. And as Dr. Sisson, we discussed earlier, they can be taken care of with anti-inflammatories.
Yeah, a lot of those injuries that you just mentioned are injuries that we are seeing in our sports medicine clinic here at Silver Spring. I mean, I think right now we're in, track season. And so I'm seeing athlete after athlete with shin splints. So that's a very common overuse injury that we're treating here.
The other thing you guys mentioned before, to pick up on a previous thread, was this idea about how you start and what you do. And so oftentimes in like January, February, we see people that come into the office with a New Year's resolution, and maybe they haven't exercised or started too quick or did too much volume or just the amount of exercise they did. And people come and say, well, I was fine. And then I started this New Year's resolution where I was going to walk 3 miles a day every day, and we see the people that have shin splints or knee pain or hip pain or other things that creep up because maybe you're not as mindful about what type of activity you're doing or how quickly it's all brought on.
Yeah, and to mention, when you say being mindful of the type of activity that you're doing, I think if you have arthritis or you have, joint problems, maybe doing some low impact exercises and workouts should be your focus. So, doing some water aerobics or stationary bike, or the activities that don't involve, a lot of jumping and running would be better for you to do. So it's not so much, stress and strain on your joints.
I agree with that. I think during the pandemic, a lot of people that previously, because there's lots of places where you can go to a rec center and find a pool during the times where people weren't getting out as much. I think a lot of the people that was part of their regular routine suffered. And I think not everybody's a water person, but there's water walking and water aerobics classes, which are great even if you're not a swimmer. And if you do have access to a local rec center or Y or something else, looking for those lower impact activities. So maybe starting with a bike or an elliptical machine rather than just jumping straight onto a treadmill, trying to lift the heaviest weight you see there is a good place to start.
Yeah, definitely agree. Well, I don't think we have any other questions in our Facebook live chat. Are there any closing remarks that you have, Dr. Sisson or Dr. Amoako?
Well, one of the things that oftentimes come up is should someone hire a personal trainer? And I get that all the time. And personally, I have gone through
Are
that same.
you, Dr. Amoako, are you telling us about your services?
No, I have actually been
an advertisement.
I have been there. I have been there where I have had a talk with my wife whether I should hire a personal trainer or not. It depends. It depends on a few factors. But on the baseline, from a doctor's perspective, you really don't need a personal trainer. It depends on your goals. If your goals is to just stay healthy, your goal is to lose weight, just medically be healthy, you don't need a personal trainer. If you want to have a certain type of physique or you want to go compete, you may need that. But eating healthy, and like we discussed earlier with Dr. Gourdin, discussing all these apps, they have specific things that you can follow if you are disciplined. If you have a partner that will do it with you, that you can follow certain things that you don't need an expert on. Once you've been cleared by your physician that you are able to do physical activity, you should be able to do it without a personal trainer. So no, the question is no. The answer is you don't need a personal trainer. But if you have certain goals or you don't think you are disciplined enough and you can afford one, then by all means go ahead. But you don't need a personal trainer to start off getting your body going.
Yeah, I agree. I don't think you necessarily need one unless you have a lofty goal that you're trying to reach and you maybe don't have an accountability partner. Sometimes the personal trainer maybe can serve as that accountability partner that some people are in search of.
And don't forget, we have all these resources that was mentioned earlier, and we'll certainly post them on the this event that Kaiser Permanente has for you. I mean, I have seen some of them and they have a ton. I mean, too many that you can even imagine. Take advantage of them. They have things for sleep, things for nutrition, things for exercises. I say take advantage of them and save your money on a personal trainer for now.
One other note I wanted to add was that, with our new sports medicine program at Silver Spring, we don't only want to see you when you get injured. If you are a person who's actively involved in sports and you want to talk about injury prevention, you want to find out ways that you can maybe keep yourself healthy and not end up with some of the injuries that we talked about, we're happy to have those conversations with you. And, if you have a young child that's high school or college age and they need a pre-participation physical, we're happy to do that for you as well. And of course, if you get injured, please come see us. Any kind of sprain, strain, pain or anything that is non-surgical, we would love to take care of you at our sports medicine program at Silver Spring. So please, use this as a resource.
That's great.
And I just a quick plug in, and Dr. Sisson, you can go. As Dr. Gourdin said, please take advantage of what Kaiser has. Besides all the other things we've mentioned, we are there for you. Pre-participation physicals, annual physicals. Take advantage of it. You are paying for the insurance. I would say, please come. We are ready to see you.
Yeah, and just on the way out, I appreciate and thank everybody for joining. Thank you, Dr. Amoako and Dr. Gourdin.
Yes, thank you.
We're certainly here to help if something gets injured or broken, but making physical activity just part of your life is good for you overall. It doesn't have to be painful, and I just encourage people to find ways that it fits into their life and that they enjoy doing it. So that's it. Doesn't have to fit anybody's mold. Find something that you like and will keep up with.
Thank you, Dr. Sisson. Thank you, Dr. Amoako. Great
Thank you.
conversation.
Thanks, guys. Take care.
Bye-bye.
Bye-bye.